Okay, ma'am, ready.
Both are ready?
Yes, I'm ready to.
Okay. So if you've read and understood, considering it communication skills station, please begin.
Hello, good
Uh,
evening. Good
Good
evening.
evening.
I'm Dr. Fyong. I'm one of the surgical doctors working for Mr. Man, and I'm calling to speak with the ITU registrar. Please, can I confirm I'm speaking with the ITU registrar?
Yes, I'm cardiothoracic registrar.
Okay,
I'm the IT registrar.
okay, okay. I'm calling with regards to a 76-year-old lady who presented to our accident as an emergency with the complaint of sudden onset abdominal pain. And on examination, she's tachycardic. And uh, okay, and on investigations we did, the ABG showed metabolic acidosis and a drop in her hemoglobin levels. And we did some imaging investigations, such like an ultrasound, which showed a free fluid in the abdomen. And our assessment was perforated viscous, and we are preparing her for an urgent laparotomy. So I was calling to seek for your advice preoperatively and also to prepare an ITU bed post-operatively.
Okay. What is the patient taking for the COPD?
Okay, she's taking steroids for it.
Okay. What made you think of the perforated viscous?
Okay, the sudden onset abdominal pain and the chest X-ray also we did showed free fluid in the air below the diaphragm, and then the ultrasound showed free fluid in the abdomen.
Yes. What fluid resuscitation will you do?
Okay, I'll give her a Hartmann solution about 1 to 1.5 liters, and then I'll pass a urethral catheter to monitor urine output and also monitor her level of hydration.
Okay. Uh, what preoperative arrangement do you suspect? Do you suggest for here?
Okay, since the patient has COPD and is taking steroids, so I'll like to speak with the pulmonologist and also seek the advice. And bearing in mind the patient is taking steroids, so I'll consider doing an induction with 100 milligram of hydrocot.
Okay. And what else?
Okay, I'll preoperatively I'll also pass an NG tube to decompress the stomach and ensure adequate fluid hydration. And having collected samples for core sensitivity, I'll start the patient on antibiotics after
Yes.
consulting with the microbiologist.
Okay. Um, what is the criteria for ITU admission?
Okay, for this patient, patient has chronic obstructive pulmonary disease, so the patient might need ventilatory support. And also from the lab investigation, it showed elevated creatinine. So patient has AKI. So that is two organ dysfunction. And that's the reason why the patient meets the criteria.
Okay. Um, how will you monitor her response to fluids?
Okay, first of all, I'll look out for her mental status, also the urine output after passing the urethral catheter, capillary refill, the pulse rate, and also the blood pressure.
Okay. Your patient has COPD. Did you check for the oxygen level?
Oh, I'm so sorry. I didn't see it on the note, but I'll get back and check.
Are you going to give her oxygen?
Yes, I'll give her oxygen via nasal prongs, bearing in mind she has chronic obstructive pulmonary disease. But I'll keep the saturation level between 88 to 92%.
Okay, excellent. Maybe she is on 28% oxygen. Do you want to increase this rate or no?
No, I wouldn't want to increase it because I don't want to take up the respiratory drive.
Are you going to repeat the EPG after giving oxygen?
Yes, I'll repeat the ABG after giving oxygen.
You
Hello? Hello?
Yes. You told me that hemoglobin is dropping. What are you going to do about that?
Okay, I'll collect sample for grouping and cross-matching, and I'll speak with the hematologist for advice for a possible blood transfusion.
What is possible ECG finding in her case?
Okay, I'll look out for signs of atrial fibrillation and also signs for hypokalemia on ECG.
How would you treat AF?
Okay, I'll speak with the medical registrar, and I'll first of all identify and treat the cause, which in this case is likely the hypokalemia, and I'll also control the region with beta blockers and then provide anticoagulation.
Is your patient really needs ICU admission?
Yes, doctor. Yes, doctor.
Why?
Because my patient has chronic obstructive pulmonary disease and will likely need ventilation post-operatively, and then with the acute renal failure, that's two-organ dysfunction. My patient meets the criteria for ITU admission.
What if I only have one ITU bed left and there is an asthmatic young lady coming first? Has a status asthmaticus.
Okay, I'll continue monitoring the patient in the recovery room, and I'll speak with the bed manager to expedite the discharge of stable patients, and I'll wait.
Is that
Okay.
operation killing the patient?
The operation is very risky for the patient, considering the background comorbidities, but the patient needs the surgery urgently. And that's why I also called you, so that operatively we can prepare the patient appropriately.
Okay, thank you.
Okay, thank you.
Okay, doctor, you said chest X-ray was done. What was the report? What does it show?
The report showed air under the diaphragm.
Chest X-ray was clear. So when are you planning to repeat the chest X-ray, doctor?
I'll repeat the chest X-ray again once we are done with the
When?
call. Sorry.
I asked you when.
Okay, when?
When?
Okay, preoperatively.
Preoperatively, yes.
I'll repeat preoperatively, yes.
Yes. Aim is to see what?
To rule out chest infection.
No, to see gas under the diaphragm.
Gas, okay, the gas under the
Free air,
diaphragm. Okay,
yes.
sorry. Okay, I thought you were asking for the COPD. Okay.
No, COPD you already know. Okay, are you sure that patient has taken its steroid inhaler in the morning today before coming to the hospital?
Okay, I'm really sorry. I'll have to check the notes again, and I'll let you know.
Thank you. Why do you think patient might have a drop in hemoglobin? Is patient in shock?
The patient is in septic shock, likely.
Okay.
Maybe
Is patient febrile?
I'll have to. I'm really sorry. I don't have the information. I'll have to check the notes, and I'll let you know.
When chest X-ray that you did on admission is clear, how have you established that patient could have a perforated viscous?
Okay, because also on ultrasound showed free fluid in the abdomen.
And what else?
Yeah.
And what else? What else have you done to establish this diagnosis?
Okay. I can also do a CT.
No,
With
you've already done something in
okay.
addition to ultrasound, which has helped you establish this
Okay,
diagnosis.
metabolic acidosis,
Sorry?
arterial blood gas.
No. Okay.